How's it going, guys? So this is a medium difficulty question for neuro. There are two important factoids I'm going to communicate in this clip. Even if you think this is hyper basic, I'm still going to communicate some important points here, not waste our fucking time. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. Really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the clip. So 50-year-old woman, type 1 diabetes mellitus. She has a 2-day history of fatigue, fever, and confusion. Current medications include metformin, lisinopril, simvastatin. Temperature 101 Fahrenheit, heart rate 90, blood pressure 150/90. CT of the head shows no abnormalities. EEG shows spike complexes over the temporal region. LP is performed. CSF findings are shown. Protein and glucose are within the normal range. Cells are elevated with lymphocyte predominance. RBCs are elevated. Now, and the question is asking the most likely explanation for these findings. So RBCs in the CSF, obviously unusual. We could think of etiologies such as traumatic TAP or subarachnoid hemorrhage. And by all means, this patient has hypertension, which is the most common and significant risk factor for subarachnoid hemorrhage due to rupture of a Berry/saccular aneurysm of the anterior or posterior communicating arteries of the circle of Willis. However, if we had a subarachnoid hemorrhage, not only might they say the patient has worst headache of her life, but we would clearly see that on non-contrast CT of the head, which we don't have here. We could also conjecture that type 1 diabetes causing atheromata within the lenticulostriate vessels in combination with the hypertension can lead to the atheromata/lipohyalinosis lead to intraparenchymal hemorrhage. But once again, we do not have any blood detected on non-contrast CT of the head. So your factoid, your first factoid that you need to know is that herpes encephalitis, HSV 1 or 2, can cause temporal lobe hemorrhage with RBCs in the CSF. Okay, that's your first factoid. Your second factoid is that CT of the head is often negative in the setting of temporal lobe hemorrhage due to herpes encephalitis. However, they might tell you EEG shows spike complexes over the temporal region. You're like, well, they still said temporal something. Okay, so that's two important factoids here, that the hemorrhage from the temporal region can be negative on the CT of the head. It's not my fucking opinion. I've seen it on 2CK and BME. Now, when we look at the CSF findings, you should know your classic textbook picture of a viral etiology, which will have normal protein or sometimes slightly elevated protein, but usually normal protein, normal glucose, increased lymphocytes. Bacterial and fungal are both going to have increased protein, decreased glucose, except bacterial is going to have increased PMNs, polymorphonuclear cells, which are neutrophils, granulocytes, whereas fungal will have increased lymphocytes, okay? And once again, herpes will often have RBCs in the CSF. Now, the caveat is that when you get to 2CK, where the questions are harder, sometimes the CSF findings will not be 100% what you expect. I've seen herpes questions where RBCs are not elevated, okay? But you can eliminate to get to the answer. I've seen presence of monocytes in questions, okay? Tuberculosis can give you tuberculous meningitis can give you super fucking elevated protein. So there's going to be harder CSF findings, but you need to know your classic picture of viral, fungal, bacterial, as I just described, as well as herpes, often presenting with RBCs in the CSF. I should quickly note that encephalitis is characterized by confusion on USMLE. They love that finding, confusion for encephalitis, whereas meningitis is going to be meningismus, stiff neck. Okay, subarachnoid hemorrhage can also cause a stiff neck. And IV acyclovir, all right, that's the treatment for herpes encephalitis. They might give you the same fucking vignette, and then the answer is just acyclovir. Easy question. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.